Hello, 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 everyone. I am so excited to have Nurse Practitioner Deidre Arms with us again today. This is our second in a series known as Desire Wellness with Deidre Arms, Nurse Practitioner. In the first episode, we talked a lot about nutrient deficiencies caused by your vascular and cardiovascular medications, such as blood thinners and statins and beta blockers, all of the above. We talked about the need for CoQ10. We talked about the fact that some blood thinners and can actually lead to a little bit more fatigue, can lead to weight loss, lots of stuff we covered. So make sure you check out the playlist that we've created with everything. I'm talking everything that Nurse Practitioner Deidre covered. We have 12 videos that we are releasing this week. We have already about 4 or 5 up, and we're going to be rolling them out clear through Sunday. So make sure you do check back every single day for those videos to find out more about all of the different nutrient deficiencies that your cardiovascular and vascular medicines may or may not cause. Today, Deidre, so excited. We are talking about one of my favorites, magnesium. It is so necessary. We have an advisor for our organization who said there's 3 main causes of disease: lack of oxygen, lack of water, and lack of magnesium. And yet magnesium deficiencies are so common. So I'm going to turn the floor over to you and to let you get started.
Okay, perfect. Hi, everyone. So, talking a little bit about magnesium, it is one of the top micronutrient deficiencies in the United States. So that's something to think about there. And how does that play into your overall health? About 50 to 60% of magnesium in the body is found in our bones. And then the other half is kind of found in our soft tissues, such as our muscles. And then we have a small percentage in the blood as well. And you may have heard that magnesium is important for over 300 enzymatic reactions in the body. It helps regulate your glucose levels, your blood pressure. It helps to produce energy, helps support detoxification, and it plays a role in transporting calcium and potassium into our cells. So I want to specifically talk about heart, nerves, mitochondria today, because there's so many things we can discuss with magnesium, but our heart's a muscle too. So not only is magnesium needed for skeletal muscles, but also our cardiac muscles as well. And deficiencies can lead to high blood pressure. It can lead to heart disease, arrhythmias such as AFib as well. So magnesium is really important there. And we'll talk a little bit about what medications can deplete magnesium. And today I wanted to talk a little bit about the different forms of magnesium, because it's not a one size fits all at all. It's also important for your nerve conduction. So magnesium kind of transports that potassium and calcium into our cell membranes, and the deficiencies can cause numbness or tingling in our extremities. So sometimes that gets misdiagnosed as a neuropathy when it's actually a deficiency. And then our mitochondria, which is our powerhouse of our cells, that's what produces energy. So it also stores magnesium and uses it to create additional energy sources called ATP. And so when we're deficient in magnesium, especially in the cells, we don't produce enough energy. And the side effect to that is what? Fatigue, right? How many of us have fatigue? It's known to be one of the number 1 deficiencies that we see. So we absorb it in our small intestines here, right? And our blood is controlled by the elimination of our kidneys. So that's how we eliminate it. And I'm going to just talk about recommended daily, like what you should get. And you do get this through food sources. So I always like to start as food is medicine. And so we'll talk about food sources of magnesium as well. But somebody Age 19 to 50, if they're female, 300 to 320 milligrams, males, 400 to 420 milligrams, and then 51 and older, for females, 320 milligrams. For a male, it's 420 milligrams.
It's so interesting that magnesium is so important. And in those top three that I mentioned in the beginning, that it's amazing that doctors don't make a bigger production out of it. I remember when I was low in magnesium, it was in my blood work, but when I went to the consult to follow up on my blood work, it was not mentioned at all. It was, hey, you're doing great, good job, and we'll see you in a year. I went home, I looked at my blood work actually myself, and I thought, well, what the heck? I'm really low in magnesium, and it shows up with a big red flag. And yet the doctor said absolutely nothing. And I don't understand why. Is it something that they don't teach in medical school? Do they not realize the importance of it and the impact that a low level of magnesium has on your body and the potential for disease?
I think really some of the times what we're thinking about is in this fast-paced environment of the medical world, we're looking at the most acute things that can cause a disease. Something like looking at high levels of your glucose and looking at high levels of cholesterol. And then we really stop with the minerals and vitamin needs that people have. Most people in the medical field, it's said that they have about 4 hours training in nutrition. And so that falls into these nutrients and micronutrients as well. So, and when you have a deficiencies like from magnesium, it can be from malabsorption, it can be from drinking alcohol, it can be the parathyroid, it can also be like renal disorders that are wasting, diabetes, your diuretics, digoxin. So some of those medications that we see. And what were some of the symptoms, Kim, you were having with the low
Fatigue,
magnesium?
fatigue.
Yeah.
And also my muscles and my joints felt like they were a little tight. And so I as soon as I up my magnesium, and even Joan here, who's in our live studio audience, was mentioning that she used a spray. I used a spray that was pure magnesium as well. But with me, with the spray, it was a little irritating. And so what I was suggested to me by my functional medicine practitioner was just spray it on about 20 minutes before you're going to go in the shower, let it absorb, and then go rinse it off, and that has worked for me. So it's just part of my regimen now, just to spray a little magnesium on my legs, and then I go in the shower. And the other one I do is an Epsom salt soak of my feet. And I'm just curious your thoughts on the transdermal. I know you were going to get into all the ways in which you can take magnesium and replenish your body, but I'm skipping ahead. I'm curious your thought on I'm all over the place, but whatever's on my mind. But transdermally, what do you think about getting your magnesium that way, and how much it's actually helping versus taking it
So
orally?
somebody who has like severe gut dysbiosis or they're having trouble with absorption of things, a transdermal route of many medications and minerals and things can be really impactful. One thing I thought was great, you said you did the Epsom salt soaks on your feet. So our feet have the largest pores of our body and can pull in nutrients. That's why I don't want to skip around with a lot of things, but grounding outdoors and walking on the ground to absorb the magnesium thing is really important. It's pretty powerful thing to do for your vascular is to do grounding. So
Wow, we'll have to get into more of that because I love that. Just regular soil, or are you talking on the beach or
your beaches, walking outside, as long as they're not treating the lawn with chemicals, you should be able to walk and absorb the nutrients. They say, we weren't really meant to wear shoes all the time. So,
our diabetics though have to be a little bit careful, especially if you have neuropathy. But other than
exactly.
that, just be careful of where you're walking and making sure there's nothing sharp.
Right, right. But how many of you have been to the beach and have walked barefoot on the beach and feel so much better?
Oh, it feels so good. You do. You feel replenished. You actually feel grounded.
Yes, yeah. So, and some of those symptoms you were talking about, low magnesium, definitely that fatigue, but it also can feel like muscle weakness or spasms, trouble sleeping at night, depression can be a result of low magnesium, constipation. So that's one thing. We'll talk about which magnesium is best for constipation and things like that. Arrhythmias, and then high blood pressure. So you need those. And your food sources are those dark leafy greens, oatmeals, your buckwheat, so your grains, your chocolate in the form of dark chocolate's probably
Oh,
best.
I like you. You're my favorite person today. I'm going after that dark chocolate.
Exactly. And your nuts and seeds, and even like lima beans. And last week, just to fall off that, we were talking about eating the rainbow. How did that go for everybody?
We did amazing. We actually have a winner. Right after we did it, we had Lisa that ended up posting right away her entire rainbow on her kitchen sink. So I can show you, I can find it and show it to you in just a few moments. But yes, we did have a winner. So every week we're going to be, you show us the rainbow, you post it in our social networks, padsupportgroup.org, padsupportgroup.org, and you go ahead and you post in there a picture of the rainbow that you're eating on your plate or in your shopping cart. And we are going to pick a winner each week to get a rainbow t-shirt saying, I ate the rainbow.
That's right. That's right. Well, awesome, Lisa, for posting. Really helps other people to think of new things to eat and everything like that. Some other things that can be caused by deficiencies of magnesium that I wanted to hit would also be that numbness and tingling. So those extremity numbness and tingling, really impactful to know your magnesium status. Although sometimes drawing a serum magnesium isn't the end all be all to know if you have a magnesium deficiency. So for Kim, hers showed blatantly low, but many people have deficiency and it doesn't show low. Another way to look at that is when you get a comprehensive metabolic panel. When you look at the alkaline phosphate, it's known that anything under 60 in an alkaline phosphate could be a deficiency in zinc and magnesium. So it's kind of like a backwards way of looking at that lab and getting that information as well. And then glucose and diabetes is hugely impacted by magnesium as well. So we ready to get into some medications here?
I think so. I'm going to show you Lisa's rainbow. You have red, orange, yellow, green, blue, and purple.
That looks amazing. We've got fruits and vegetables there. Oh, looks delicious.
We do, even though they call those red cherries, I think they're more purple. So she's got the blueberries and the red Bing cherries. So absolutely perfect. Eat the rainbow.
Yes, love it.
Yes. So, on that note, I do think why don't we get into some of those medications, especially cardiovascular and vascular, that are leading to those magnesium deficiencies that could be causing the fatigue and muscle weakness that we've been talking about.
Okay, so first would be your diuretic, so your hydrochlorothiazide, Lasix, things like that. They can cause the kidneys to get rid of that extra fluid, and that extra fluid actually can lead to, magnesium being excreted as well. Your digoxin, which is often given to people for atrial fib, that can reduce kind of magnesium reabsorption in patients as well. And then I wanted to touch about proton pump inhibitors because so many people on these medications to protect the gut lining are on a proton pump inhibitor, and that as well can cause decrease in magnesium as well, especially when taken over long periods of time. And then other things that aren't medication related, but are just because of, our standard American diet, we have a decrease in magnesium there as well. And then stress. So our body uses magnesium to release kind of certain neurotransmitters and hormones, such as your cortisol, which is your stress hormone. And so when we are stressed, and our body doesn't understand the difference between good and bad stress, but when you are going through a health issue, that's a stressor on the body. And so those kind of things can deplete your magnesium as well. So it's the medications, but also what's going on as a result of our disease process. Got to throw in a little bit of gut health too. So it's absorbed in the small intestine. So if we maintain proper gut health, that can be really important in the absorption of magnesium. I don't meet many people that don't have some sort of GI issue of some sort: nausea, vomiting, bloating, diarrhea, constipation, all of the above. For many people, acid reflux. So gut health is really important in that absorption of magnesium as well. Did we get any specific medications that we wanted to see?
Yeah, I was thinking about blood thinners like Eliquis and Xarelto and oh gosh, especially the warfarin and Coumadins. Those aren't used as often anymore, except for folks that have, let's say, factor V Leiden and the like, but they're still used somewhat there. Or if someone ends up with a stroke, they might end up with it, or they might end up with Coumadin or warfarin if they end up with a blood clot in their lungs, pulmonary embolism. But for the most part, Eliquis, Xarelto, clopidogrel, Brilinta, all of those, I'm curious. I'm sure if it happens in one, it probably happens with another.
So I will tell you, in most of those, there's not deficiencies that have been known or supported. So there's always continuous studies going on with those. I would say more you're looking at the need, vitamin K, things like that. But there's not a specific magnesium deficiency that goes with those.
What about with statins?
Yes, with statins. So your statins, we went over this a little last week of several of the things, but magnesium can be one of those, as well as last week we talked about CoQ10. Statins also deplete several other minerals. So sometimes you have to be not just on a single magnesium, but something that does have copper, selenium, zinc in it as well. So good multivitamin or adding minerals back in as well.
Making sure it's truly a soluble multivitamin, not Centrum.
Yes.
I'm going to get hate mail from Centrum, but I did a story one time on Centrum in partnership with a plumber, and he showed me that Centrum doesn't really dissolve. It goes right down the pipes. Goes right down the pipes.
It sure does. So that's why when you said transdermal form, I was like, those people who don't have great digestion or have trouble breaking things down, a transdermal form of many of your magnesiums and micronutrients and minerals that you need is important. So.
And Joshua, our YouTube producer, wants to know more about that dark chocolate. Can we do that both orally and transdermally? I will bathe in chocolate.
Yeah, I found some great dark chocolate. I don't know if any of you have ever tried that Hue brand, but
yes,
it is probably one of the most pure chocolates you can get, and it tastes so wonderful without all the junk.
Yep. Oh, I don't know how I mean, it is so good. I use it in anything that I make that's, dessert like, because I can't have dairy, and so they don't put dairy in it, which is great.
Yeah, that's a good one. That's been my new favorite little treat.
Josh says he's a Lindt dark chocolate guy with sea salt.
Yeah, Lent is delicious. I've been to Switzerland. I've got to see where it's made. So,
Totally in, totally in. Hey, but make sure, we're not saying eat a lot of dark chocolate that has sugar in it. Um,
exactly.
the Hue, it's spelled HU, that chocolate I believe has a sugar alternative. I think it uses maybe Buddha fruit, or something else in it. I don't think it's regular. I can look that up as well, but
Yeah.
it's not regular sugar, I don't think, in the one I actually use.
No, I don't think that any of them are, and they have very minimal ingredients in them. And so they say it's chocolate that humans should have. And when I say should have, a bar should last over a week, right? Because you only need a little bit to get that magnesium.
Yep. See, it's free of gluten, refined sugar, emulsifiers, GMOs, soy lecithin, and dairy, which is really, really good. They use cacao, raw cacao, cocoa butter, and unrefined coconut sugar.
Yeah. So looking
That
for
was your
things.
commercial for the day for Hue Chocolates. Unpaid. Hue Chocolate, we're looking for donations.
Exactly.
Sponsor our Desire Wellness with Nurse Practitioner Deidre Arms. We'll even show you the recipes. No, I'm just kidding. Josh is saying, he said, you know what, I think I am going to enjoy my dark chocolate on the beach because typically the beach makes him exhausted. So maybe a little chocolate pick me up will help him get grounded with lots of
Well,
energy on the beach.
if you're exhausted, Josh, it's probably a magnesium deficiency because at least 60% of us have that magnesium deficiency. So a little beach and a little chocolate should help.
This is the best show ever. I needed this today. Oh, this is great, especially before the 4th of July. You know what I do is I get a little bit of raw cacao and I mix it with just a tiny bit of coconut oil, and I heat it. And I add just a tiny bit of coconut brown sugar, and then I put it over some sorbet, just strawberries in a blender with some. So my little recipe, just to steal the show here, is I take walnuts and 1 cup of walnuts, 2 cups of water, blend it, add the strawberries, freeze it, and then I get sorbet. And then I put the warm chocolate over the cold sorbet, and it makes magic shell.
That sounds delicious. I do a little recipe with cottage cheese. So I use that good brand cottage cheese because it's very few things. And in my blender, I add the cottage cheese, some cacao, a little vanilla, and a tiny little bit of pure maple syrup. Blend it up, put it in the fridge, and it tastes like chocolate pudding.
Oh my gosh, that sounds so good.
Yeah, I'm
So
just always
good.
trying to find protein, ways to add protein.
I have actually found, so for pudding, I just did a Foodie Friday with this, and I tried out a new recipe that was from an Instagram influencer, which I wish I could find her name so I could give her credit, but I modified the recipe anyway, so we'll just call it Kim's chocolate pudding. Because I used my walnuts and made a walnut milk, and then scrambled eggs was her secret ingredient. She
Ooh,
put in scrambled eggs in the blender with the milk and I added avocado to mine, and blended it. And I know I'm missing an ingredient or two, but needless to say, it made the most delicious, the raw cacao, of course. It made a delicious pudding. I could not believe it. It was so smooth and so creamy. Who would have known?
I
Scrambled
know.
eggs, adding the extra protein in there.
Yeah, I'm always looking for ways to add protein, and because we have such a high need for protein, most of us, and just to optimally feel well, and so that's one of the things I'm like, how can I add a little extra?
Maybe some hemp seeds over your salad.
Definitely, definitely. And we can't, give all the credit to dark chocolate. We have to talk about those dark leafy greens too. So how are we using those? Because we need the fiber from that, right? We're looking to get about 35 grams of fiber a day for women and 45 grams a day for men. And so magnesium source of the dark green leafy vegetables, there's magnesium in those as well. So that's your spinach and your, you know, all those dark leafy greens. How many of you get dark leafy greens like in your diet daily?
For the most part, you know what I do is I fix a smoothie on Sundays. And so I have at least an 8-ounce glass of my smoothie every single day that has a huge portion of spinach in it. I don't
Excellent.
know. How about Douglas? Douglas is raising his hand over there. Douglas, how are you doing with getting your leafy greens in on a daily basis? Dark leafy greens. You showed us last week that you had a wonderful tray of colorful vegetables. You were eating the rainbow right then and there and didn't even know you were doing the right thing. But I'm curious, what about those leafy greens? And you know what? Right then and there, he popped off. So I'm guessing that's a no.
I bet he's going to go get the dark leafy greens.
I bet you he's gonna go do it. Instacart, hello, deliver now. How about Marsha? I bet Marsha has some leafy greens.
I do. Not every day because again, I have loss of appetite, and there might be a day a week where I won't eat at all because I'm just not hungry. But I try to add my leafy greens. I love spinach. Popeye, do 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 do.
That's
We even got
right.
a serenade. We even got a serenade. This show is filled with lots of surprises today.
Yes.
I actually had a question relating back to magnesium and different ways that we can absorb it. Um, I used to frequently take Epsom salt baths, the whole bathtub. And since I'm at stage 3 critical limb ischemia and I have this open wound on my on my great right toe, I'm wondering if a soak like that is contraindicated.
I would definitely talk to your provider who's like healing that wound. Oftentimes it's not contraindicated, but I don't want to say something without looking at it and seeing it and assessing it. So I would definitely talk to them about it. Even if you had to wrap it or something to do a soak, or even soak 1 foot for now to get some of those mineral needs until you
Yeah,
get that answered.
I'll check with my podiatrist. She's magic. She uses these compounds, these ointment compounds, and that's what's been slowly trying to heal the wound on my toe. And one of them she calls monkey poo because it looks like monkey poo, but it doesn't smell like monkey poo.
That's a
And,
plus.
well, yes. And then another compound she uses is called toe butter. And the monkey poo, actually, you can get it on Amazon, but it's not called that. It's called Iodosorb Solocyte Wound Gel. And it's made in India by a company called Smith and Joseph. And basically what this compound is that you can't get it out of your pharmacy, not even a compounding pharmacy, but you can get it on Amazon. It's a gelatinized form of betadine, believe it or not. And the trick to it with an open wound on a toe is like keeping the wound too dry, keeping it too wet. There's this happy medium place where it heals because you need it a little dried out to help the callousing, so you don't always have this soft, delicate skin peeling off all the time. But at the same time, you don't want it too wet. So a little dab does it, and you just barely cover the site with this stuff. And it lasts about 12 hours, and it's done when it turns white.
Nice.
So,
We got a little extra wound care convo going on. Just always remember the advice and views offered are that of our guests, and to always check with your own healthcare provider and get explicit consent from them before acting on any advice or buying any products that we talk about here, including dark chocolate.
Exactly.
absolutely, but maybe on the dark chocolate.
So
Hey, we got to do our due diligence, right? But I do want to go back just because you are on here, Marcia, and it is, I'm curious from Nurse Practitioner Deidre's perspective that when you say that you're not hungry and you're not eating because of that, um, our society teaches us to eat when we're hungry and eat all kinds of stuff. But even if you're not hungry, you still gotta eat. And a smoothie might be a really good way to get those nutrients in you with, you can pack it with the protein and those good protein powders, the creatine and what's the other one? Collagen plus MCT, those types of things that we've talked about to check with your nutritionist if you can get one. Um, but it sounds like to me, Deidre, that she might need some more advanced testing, that it sounds like it's more than the medication that we discussed last week.
you may need some more advanced testing looking at what, and I would also look at, take some time to track for at least a week and see where you're falling short. So MyFitnessPal or Chronometer both have free kind of apps just to make sure you're getting in enough of your proteins. So you need that for the amino acids, especially to heal with, the big toe wound that you have. So you need that for healing amino acids, and you also need to make sure you're getting enough fiber. Usually, tracking and then talking to your nutritionist, dietitian about what can I do based on what's going on with me to be the most impactful to get the nutrients that I need to heal my body when I'm not feeling like eating as much. And just make sure the things that you are eating are the most impactful for you to get the most bang for your buck, per se.
Can I ask one last question?
Of course.
Since you think perhaps I need more advanced testing, what specific labs should I talk to my primary care doctor about getting?
I would definitely want to look at vitamin deficiencies for sure. So if you've already talked to them about medications and adjusting, sometimes looking into the gut health is really important. Not all providers do that, but if you could find somebody who will do a stool test, but looking at H. pylori is one of the things that I recommend knowing. Some labs can do that for you, but H. pylori can make you feel full even when you're not. So that's a gut bug that I always like to know about when I have patients who come to me and are feeling full and not able to eat. I want to know what's going on in the gut. And then there are ways to look at micronutrients to make sure that you're getting everything. But I think first starting with asking, can you just do a comprehensive metabolic, looking at your vitamin B's and D's, looking at your omegas, do some tracking of your food, and then looking at gut health as well. And H. pylori and calprotectin are the two things because it looks at inflammation in the gut.
And I'm curious, Marcia, have you ever been checked for an aneurysm in your aorta?
No.
That's something that I would check, with you're here because you have vascular issues, and I can't remember where most of your blockages are, if they were more, below the knee and into the foot, or if they were up higher, but it might be time to go get that CT angiogram of your abdomen down, or even an echocardiogram to check your thoracic aorta as well, because that can actually lead to a feeling of nausea. You don't want to eat, just decreased appetite. And that was kind of the start for my mom. hers was a little bit of shortness of breath, and then it got into, she started eating less and less, and then it became where she started having radiating back pain, and on and on. So just worth checking.
Yeah, thank you. My last procedure that I had done with Dr. Lee, I looked in the patient portal and he did do an angiogram of more of my thoracic aorta, abdominal area. But I do
Okay.
have a stent in my LAD also, which hasn't been checked, I think, in a couple years. I'm not sure. Maybe Dr. Lee did check it and I didn't catch it.
Not
But
likely. He's an interventional radiologist, I believe.
cardiologist,
Is he a cardiologist?
yes.
Oh, wow. Okay. Well, then he might have. I would definitely check with him and
Yeah.
ask him to double check on that. And if you want, you can, have me, I can check for him, with him too for you.
Yeah, he pretty much told me my last procedure that he felt like going down into my leg. He got down to my perineal artery and hit a really calcified obstruction there, and a piece of the calcium flecked off, and it actually perforated the artery. So he had to stop the procedure, and he told me to come back, and I went back on June 11th, and he re-explored. He did a little bit more cleaning out, and he told me that he felt like that was really all he could do. He felt like to do any more at this point would be causing more harm than good, and to
Yep.
check
And
back with him in 6 months.
even with these procedures, back to Deidre, um, any procedure can also lead to a depletion of nutrients, such as magnesium, I would imagine.
Yes, and some of them, if they're using like preps and things like that, even more. So
Yeah, and the fentanyl that they use and the Versed and stuff like that, I imagine that has a depletion factor also.
yeah,
All right, thank
Definitely.
you.
Thank you, Marcia. Okay, we have Rebecca, who's watching via YouTube, and she says that, yeah, she's been, um, having low energy, lots of fatigue, magnesium.
possibly so. I wanted to go into a little bit of the different types of magnesium, why we had a little bit more time, because it's always so confusing when you go to the store or you're told to take magnesium and you go and you look at them and you're like, which one? You want to pull your hair out about that one. But there's about 8 different types of magnesium that,
Oh, wow.
yeah, it can be supplemented. And so that's why I was saying last week, there's like, this one's good, this is better, this is the best type thing. And so when you're thinking about magnesium, and if your provider tells you you should supplement based on your symptoms or your labs, you want to ask a little specifically, like which one is best for me based on what you're seeing there. The 2 cheaper ones is your magnesium oxide. So magnesium oxide, it has poor absorption. So it's very cheap, poor absorption. It really is mainly to help with constipation. It's also used for heartburn and indigestion as well. But so know that one is the cheapest, but it's also the least absorbed. So that's something to talk to your provider about. And then comes the magnesium citrate. This one actually helps more migraine sufferers, people with headaches there. It reduced your migraines by about 41% in studies that we've seen. It does have a mild laxative effect to it, so it can cause bowel movements as well. One that is, I always call this one, like if you're looking in the store, magnesium glycinate's a lot of times one of the better ones because it's easily absorbed. It has a calming property to it. It's also the gentlest magnesium supplement on the stomach, and it doesn't cause kind of GI issues. So for some people, they'll say they've tried magnesium and it just makes them have diarrhea, and it could be the wrong magnesium for you.
Yeah.
Glycine alone, that's in the magnesium glycine, can be taken separately, but it actually improves sleep. So I usually tell people, you know, if I'm telling somebody to supplement magnesium, it's best to do it at bedtime so that you can get the sleep properties. It can relax those muscles. Typically, when you're on magnesium, then you wake up and that's when you have a bowel movement because your bowels have had the time to rest through the night as well. And then magnesium chloride, that has been used like in studies for women with fibromyalgia because it improves kind of those symptoms of pain from that. It's easily absorbed as well in the digestive tract. It can be topical to relieve pain, so that's one that we can use topically as well. Oral or topical for that one. And it can help with heartburn, constipation. And then we have magnesium malate. That was one that I wanted to talk about as well. This one is more natural in some of your fruits and vegetables, wine. It does have a sour taste to it, and it can be used as a flavor enhancer in many things. So you see that one enhancing foods as well. You have great absorption with magnesium malate as well, and it can be the one that we use to increase magnesium in our red blood cells. So when you do a serum lab, which is a blood draw, and the magnesium's low there, magnesium malate is a good one to help bring that up. It is easy on digestion as well, but it does kind of lean towards the looser stools. So some people don't like that when they're having that as well.
And Kim is saying that her cardiologist told her to take magnesium glycinate because it absorbs well.
Yes. Yeah, I would say that's like when we're looking at what's out there, that's one that gets recommended a lot because easy absorption, less GI side effects, also promotes sleep as well, and that can be an issue. And then we have the magnesium orotate. So that one's also easily absorbed, broken down in the stomach as well. It's also been shown to have heart health boosting properties. So. And then we have the magnesium sulfate. This is what's in Epsom salts, so the soaks for that. It can, you know, relieve constipation if it's especially taken orally as well, but we also use it to soak in, to help with skin, to kind of help raise our magnesium levels in our blood as well, but it's really helpful for pain and relaxation. So that's the one you see in Epsom salt. And then your magnesium taurate, that's kind of one that's starting to get a little more oomph in it with people talking about it. It's kind of combined with magnesium and your amino acid taurine, I'm sorry about that. And this helps blood pressure. It can help with insulin sensitivity as well. So these are all the different ones that you can see at the stores now, online, and just so you know, check out the different types of magnesium and ask which one's right for you.
And what if you don't necessarily have low magnesium? Can you take a separate magnesium supplement, or should you take an extra magnesium supplement? I'm thinking mine came out normal in my last lab, actually, which is really good. But I'm wondering, you know what, I have trouble sleeping. So that might be helpful at maybe a low dosage.
Right, and so when we look at if you have a normal lab, we also look at those symptoms that you're having because magnesium symptoms of deficiency is what we look for. So increase in anxiety, arrhythmias, constipation, feeling tired, your blood sugars being off, your blood pressure increasing, having migraines, muscle cramps, nausea, numbness and tingling, weakness. All of that is a sign of magnesium deficiency. And so sometimes the lab will look normal, but only 1% of our magnesium's in our blood. So that's why we've got that majority of it in the bone. And we also, looking that we're absorbing it in the intestines and everything, but we don't always have it in our blood. It's like 1% in the blood. So when you draw the lab, it's hit or miss if you get a true reading.
And Rebecca, based on the conversation, she's writing on in YouTube comments that she does in fact have H. pylori. She also has peptic ulcers, possibly an aortic, slight aortic aneurysm that they're watching. And she is now encouraged to call her gastro on Monday because she keeps losing weight and she has GERD and all the above. So you're giving her some great fodder for conversation with her gastrointestinal doctor on Monday. So this is great. Good job, Rebecca. Yes, please give them a call. They may even be in the office on Friday. So you might want to give them a call on Friday. I know many doctors are open still on the 5th of July.
That's true. Or if
The
you have a
sooner the
patient
better.
portal that you can send them an email, that's always a great way too.
And you can also check your blood work because as I discovered at one point with mine that I had this low magnesium level and no one ever mentioned it. So you might want to double check some of your previous bloods because it is something that they regularly check for. As far as, I mean, with me, I never requested it, so I seem to get it annually. So it might be
Yeah,
something to just check some old bloods that might be listed under results in your portal as well.
exactly. So,
Awesome. Well, this has been a really good conversation. I want to go over some of those foods again that aside from leafy greens, so we lost one of our friends here because he's off going to get those leafy greens that we talked about. Leafy greens, dark chocolate, what else can we get the magnesium into our bodies naturally with?
oatmeal or buckwheat, and I know,
Oatmeal or buckwheat. Okay. That's good for
um,
people who are gluten free.
yeah,
I can't,
or,
no excuses for me.
nuts and seeds. So getting nuts and seeds are a great way to get magnesium. It's also a great way to get some of the other protein and amino acids. Your lima beans are a good source of magnesium. And then, if you make buckwheat pancakes, you have to have a little molasses on it, and that's a little extra magnesium there.
No way.
Yeah.
I love that. That's
So,
such a brilliant idea. You can add molasses to a lot of things. I'd even put it over my strawberry sorbet. Just a little
yeah,
extra sweetness. I think that
yeah.
would be perfect. We have a
It's a good-
question coming in from Marie, though, a little bit separate, but what helps to raise the B12? They said hers is low. I know we talked a little bit about it last week, but what helps to raise B12? This question comes up a lot.
Okay, so your food sources of your B12 vitamin are red meats, poultry, fish, your eggs, milk and cheese, and shellfish. Those are the top things that help to raise B12 as well. Many people do have to supplement because the need is high based on medications, like we talked about last week as well. Some of the better forms of your B vitamin are like your sublingual or your liposomal. We talked a lot about that. It's a better absorbed B vitamin there. Things to think about though, why are you deficient? And, it can be because of not absorbing it. It can be the medications. And we talked last week that medications, the top one known for that is metformin. So diabetic medications and your proton pump inhibitors are huge ones for that. Whenever I see deficiencies, I always think something's going on in the gut. So H. pylori is another infection that can cause that, and anemia as well.
Hope that's helpful, Marie. It's really good to get to the bottom as to why you have those deficiencies, especially when it comes to B vitamins. You could even have the MTHFR mutation, which could explain so much with your body. I have it, my dad has it, ends up where I just am not absorbing my B vitamins. And so my homocysteine levels are up, and that's like nails on your artery walls. So definitely worth checking. And one way that you can get an indication whether it is the MTHFR mutation, and correct me if I'm wrong, Deidre, but it's by checking your homocysteine levels. And I don't know if you've had your homocysteine levels checked, but that's an enzyme. And as I said, it's like nails on your artery walls. And it can't be broken down if you have this MTHFR mutation and you're low in vitamin B, correct?
Exactly. And optimally, so cardiovascular, you want it less than 10 to help, but optimally, you're aiming for a goal of around 6 to 7 or lower to get the most benefit from the B vitamins and everything. And so checking a homocysteine, seeing where you are, and then you follow it to make sure it's trending down when you're adding in things to get the B vitamins.
Mm-hmm. Good advice. So any final thoughts here? We have just a few more minutes left. Any final thoughts on magnesium that we did not cover?
Testing it in the red blood cell, so lab draw there. Just remember only about 1% of that's found there. So if you're seeing it and it looks normal there, but you have all the symptoms of deficiency, really important to have that conversation a little bit more. Even have them look at your alkaline phosphate, which is in a comprehensive metabolic. Anything under 60 is also an indicator of magnesium and zinc deficiency.
There's always so much that we have to go in there, and we have to take notes and prepare for our appointments. And just an FYI for anyone who needs help preparing for their appointments, and you know, I'm in all of these sessions with Nurse Practitioner Deidre and other doctors, and so boy, do I have a laundry list of questions that people should be asking. So I'm happy to work with you before any appointments that you have and put together a one sheet of questions to ask your doctor, whether it's a primary care doctor, a gastroenterologist, or a vascular specialist. I'm here for you. Our team is here for you at the Global PAD Association, and you might as well take advantage. It's free. And we sit down with you for about an hour and we prepare a one sheet that you can take in with you for all your appointments. It's always important to be prepared.
It is, yeah. Yeah, well, you want to optimize the sometimes 10 minutes that you get with somebody, right? You want it to be the most impactful. I sometimes, I do longer appointments, obviously, because I'm in a more functional medicine, taking long times, but I will have people, even for those appointments, send me a portal message of what they want to know and talk about ahead of time. So I'm prepped in my mind of what's important to them, and we make sure we get through that. So.
And actually, that's what we do is if we do know the doctor, or if the patient is able to, get us their email, or we can actually, send it to them. We can send them the one sheet and they can upload it into their portal, into an email to their doctor. The doctors do really like having them because they're written in a more conversational manner, and you're not sitting there rushed and having the influence of the stress and anxiety of being in the appointment and fearing that you may not remember a question or whatever it might be, or even fearing what they're going to say. That's not going to interfere with making sure you're maximizing your time with the doctor, right? Is being prepared and writing those questions down. Well, thank you, Nurse Practitioner Deidre. We really appreciate your time. This was absolutely fantastic. I love doing a deep dive into one particular nutrient as we did, because it makes it so much easier that when patients have questions about, let's say, magnesium, I can say, watch this. It's a 1-hour video and you're going to have everything you need. You're going to learn about the testing. You're going to learn about signs and symptoms. You're going to learn about how to maximize the natural way, which is with your vitamins. You're going to learn about how to get magnesium transdermally through a foot soak with Epsom salts or a spray on natural magnesium spray, or even orally, and all the different types of oral supplements that you can get when it comes to magnesium and how to know the difference. So really valuable information. Oh, and my favorite, Deidre, chocolate, lots of dark chocolate,
Dark
dark chocolate. Thank you so much, Deidre, for your time. We really appreciate you. Any idea what we're going to talk about next week?
Well, we can stay on these micronutrient deficiencies. That's what I was thinking. There's still so many we haven't even got to. So
I'm thinking, what about potassium?
let's do potassium.
Okay, next week we're going to be talking about potassium, and this is a huge one because just today, one of our patients, actually a really good friend of mine as well, her mom ended up with an aortic dissection, and literally we just found out she's doing okay. She got through the surgery to repair the aortic dissection, but within the 2 weeks leading up to this, she ended up going through bags and bags in the hospital of potassium, and it was just not even cutting it. And so I don't know if there's any correlation between the two, something that we'll have to probably explore next week. But thank you so much, Nurse Practitioner Deidre. Make sure to go to desirewellnessgroup.com to check out Deidre's website and to learn more about her practice in Ohio. If you are in Ohio, definitely you can go see Deidre, but we appreciate you being here and helping to support the Global PAD Association as our wellness director and for providing such great information every single week.